we're going to talk about shoulder pain and cell-based therapies and how these might be able to help. So the shoulder joint is a remarkable joint. It's one of the most flexible, versatile joints that we have. But the more flexible and the more versatile that joint is, the more prone it is to injury. It's almost like 4.5 million people a year injure their shoulder. The most common conditions of the shoulder can be memorized by that really good drink that we had in the 70s called Tab. Remember, there's that wonderful diet drink that we had. And that stands for tendinitis, arthritis, and bursitis. And the combination of that leads to the dreaded rotator cuff tear. And the causes of this tendinitis, arthritis, bursitis, and rotator cuff tear can be somewhat controversial about what are the real causes. They try to look at occupation, and there seems to be some types of occupation, like certain types of fishermen, that are more prone to rotator cuff problems and shoulder problems. But the reality is it's multifactorial. And what that just means, that's a fancy word for saying like, there's a whole bunch of factors that we haven't figured out yet. But other researchers have looked at a cellular level, and they've noticed that this portion of your shoulder here becomes quite deficient in stem cells as we age. And in fact, by about the age of 50, most of those stem cells are gone. And that about 30 to 70% of our stem cells by the age of 50 are gone in this area. And then you have to think about, where do you see most of your patients that have shoulder injuries and shoulder problems? It's usually above that age 50. And this could be a cause, and now we have a solution for it. So now we know what potentially could be the cause of all these rotator cuff problems, and later on in life, where about 1 in 3 people at the time of their death has a rotator cuff tear that they don't even know about. And now we have a potential treatment for that. So if we went ahead and added stem cells back to the rotator cuff and the shoulder, would that make a difference? Well, some researchers out of France looked at that. And what they did was they did a standard repair of that rotator cuff. And then in another group, they did the standard repair, but they added stem cells, and quite a bit, almost double what we would add to the knee. And what they found out was that 100% of those tears that were augmented, meaning that they were repaired with the stem cells, had that repair still intact. And that when they went 10 years out and they looked at ultrasounds and MRIs on these same groups of patients, they found that the ones that had the stem cells 10 years out, 87% of those rotator cuffs were still intact. But if they didn't have the stem cells, half, only 44%. So this theory that your stem cells and the lack of stem cells may be the cause of rotator cuff problems may be true. Obviously, further studies have to be done, but this is a step in the right direction. Not only can stem cells help, but platelet-rich plasma, that stuff that we take from your blood that is just the platelets that have all these growth factors in the alpha granules. Can those growth factors help us? Well, again, comparing somebody who has a partial rotator cuff tear, but not a complete one, but a partial tear, it seems that that is superior in treatment to our standard treatments, such as steroid injections. And also just common bursitis and tendinitis of the shoulder, like biceps tendinitis, seems to respond even 4 years out from a single injection of platelet-rich plasma. So stem cell therapy and platelet-rich plasma therapy for shoulder conditions can be helpful, but it's not the whole picture. It has to be combined with things like physical therapy, and you have to have the right diagnosis to go ahead and provide the right treatment. So you should be seen by a board-certified orthopedic surgeon who knows what the shoulder is all about and give you that right diagnosis so we can give you the right treatment. But overall, these are your cells for your healing.